SN2B, and for today I will be doing the Perilite Exposure procedure. Now, the purpose of this procedure is first to provide comfort for the client, to increase the blood circulation of the client, and lastly to hasten wound healing of the client using a perilite or perineal lump. Now, following the nursing process, I will do an assessment first to my client. So I will check the client's condition before doing or starting the procedure to assess if there are any infections or open wounds in the perineal area. So good day, ma'am. I will just check your perineal area. Will that be okay for you? Okay, thank you, ma'am. Everything seems to be normal and there's just a little bit of swelling in the perineal area. Now, for the planning, I will prepare the equipments I will be needing. So I will need a perineal flushing set, my perineal lump or the heat lamp, and a blanket. After that, I will also check all the electrical equipments, whether they are working properly. So I will try to switch on and off my perilite or my heat lamp. So I will test it. So it's good. And then also, we should always remember that when touching electrical equipments, we should always have dry hands. Now, after that, I will proceed to the implementation, in which I will check the physician's order for each area to be treated and for the duration of the therapy. So let me just check the physician's order. It says here that we should use the perilite or the heat lamp for about 15 minutes to the client. After that, I will now proceed to the performance of the Perilite Exposure. So I will identify my patient and introduce myself, and then explain what is the procedure, why is it necessary, and how the client can cooperate during the procedure. Good morning, ma'am. May I know your name po? Okay, Mrs. Smith. How about your age po? Okay, thank you. So I am Principal po, your student nurse for today, and for today po, I will be doing a perilite exposure on your perineal area. So this is to provide comfort, to increase your blood circulation, and to provide you a faster wound healing. Will that be okay, ma'am? Okay, let me just confirm again. You already signed a written consent prior to this procedure, right? Okay, thank you, ma'am. So during the procedure, I want you to lie still. Do not change position or do not touch the heat lamp during the procedure, and tell me or notify me if you're feeling any discomfort, burning reaction, or untoward reactions. Will that be okay for you? Okay, thank you, ma'am. After that, I will now perform hand washing and observe other infection control procedure. After hand washing, I will also put an alcohol on my hand. And I will observe other infection control procedures. And then also, I will provide privacy to my client. So I will be closing the curtains around the bed, or I will close the door of the room. And also, I will provide an adequate lighting for me to have a clear visualization of the perineal area when I do the procedure. Now, I will start doing the perineal flushing. So, I will just put on a waterproof pad and a bedpan under my client. So, I will do it by turning my client appropriately sideways with the knees flexed. So I will just put on the washcloth. So okay, ma'am, I will put on a waterproof pad under you. Let me just turn it sideways. So I will flex the knees. Then I will turn it sideways now. And then to the other side. Now that the waterproof pad is under the patient, I will now put on the bedpan. So assuming this is the bedpan, then after that, I will now expose the perineal area of my client to wash it, rinse it, and pat dry it. So ma'am, let's just do the perineal flushing, or I will clean the perineal area, okay? Okay. So we have here a vacuum with warm water and soap, so I will press like it, side, and then the other side, then in the middle, and then put it on the cover, and then I will rinse it using warm water again, side, and to the middle, and then I will pat it dry. Let's pat it dry. Now that the patient is, though that the perineal area of the patient is clean, I will now remove the bedpan and the waterproof pad. Now, after that, I will proceed to the Perilite Exposure itself. So, I will assist my patient in a lithotomy position or dorsal recumbent position. And I will also cover her with a blanket. Okay, ma'am, let me just put you in a dorsal recumbent position. So, let me flex your knees. Okay, thank you. Do you feel comfortable? Okay, thank you. And then, now we can see that the patient is covered with blanket. I will now put on the Perilite or the heat lamp under the blanket for about 18 to 24 inches away from the perineum area to avoid burning the patient. So ma'am, I will go and put the Perilite under your blanket. So we will instruct the patient to not to change position and not to touch the lamp during the procedure. So ma'am, I want you to not to change your position, so lie still and do not touch the lamp during the procedure. So when doing the Perilite exposure, it is important for us to assess and check the patient regularly for about 5 minutes, every 5 minutes during the procedure. This is to assess whether the patient is having any untoward reactions or any burning reactions or discomfort. So let us just wait for 5 minutes. You can check now. Everything's good. Again now. Okay. Can you check again now? So, assuming that 15 minutes already had passed, so we will now remove the Perilite or the heat lamp. Or we can also do the procedure for about 20 minutes or depending on the physician's orders. So, I will now remove the Perilite, ma'am. And then when we remove the Perilite, make sure to check again the patient's perineal area for any untoward reactions. So everything seems to be normal. So I will now reposition my client in a comfortable position. Let me just put you in a comfortable position, ma'am. Thank you. And then after that, I will check whether the perineal ramp or any equipments are working properly again. So it's working again. And then after that, we should all document the findings on the client records using any forms or checklists supplemented by narrative notes of the nurses when it is applicable. And then after that, we will also do an aftercare. So I will again ask my patient if he is comfortable. Okay, ma'am, are you comfortable or there are any problems? Okay, thank you, that's good. And then also, I will perform hand hygiene. And then, after that, I will be returning all the equipments I used to the proper storage area. Now, for the evaluation, perform a follow-up based on the findings that deviate from the normal or from the expected from the client. if there is a available baseline data, compare the findings or the result, and then also report any significant findings of the deviation from the normal to a primary care provider. That's all for the Perilite Exposure procedure. Thank you.